let's talk about Norvir. Now, Norvir hardly ever is used as full-dose protease inhibitor anymore. These days, it's used as a booster. Now, what does that mean when I say booster? It actually increases the level of other protease inhibitors. And I see some people doing their hymnal song motion to me because I have shared some of this with some of y'all, that I actually remember this by my Vacation Bible School song I learned in Vacation Bible School. That Norvir is a booster. It's not acting as an antiretroviral, it's increasing the other drugs. Now, do y'all remember the Vacation Bible School booster song? Because I was told this must be a Tennessee thing, because no one here in Georgia knows the song. Does anybody know the song? No one? No one. Do y'all want to learn the Vacation Bible School booster song? Y'all want to hear it?
Yes.
Okay, y'all want to hear it. All right, here we go. Y'all know I'm a professional singer, so y'all get ready. So Celine Dion, move over. You might move over a minute. Okay, you ready? Now, we would sing this song in Vacation Bible School because the preacher would get up there and all the little kids would get up in front and we'd all sing our little hearts out because this is how I do it. Ready? Booster, booster, be a booster, mighty, mighty, mighty booster. Don't be clucky like a rooster. Be a booster for Vacation Bible School. Be a booster!
Yeah.
Okay, so that is the booster song. So every time I sing Norvir, I sing that song in my head. Because it's not, I'm like, oh, like Vacation Bible.
Song's gonna run.
Everyone's going to always know Norvir. But with that Norvir also comes along, I'm going to always find intolerance. Nausea, vomiting. If Norvir is there, I'm going to get to the patient. Take it with food. Let us know if you have any problems. I always get there and do that hand holding on Norvir. Now that we got through my singing and we're all still alive, this is my favorite slide because it's very easy. It's an integrase inhibitor. It's Icentris. It's pretty generally well tolerated. The adverse events are headaches, fatigue, and you have to make sure that if a patient's complaining of muscle pains, to check their CPK elevations. So that's it. That's a simple. That's the reason why Manish gave it to me, by the way. Your turn.
And the last medication that we're going to talk about this evening belongs to a category of drugs called CCR5 inhibitors. And this whole class, again, is relatively new, just like the Raltegravir, which is it came out on the market maybe about 2.5 years ago. And relatively to the other medications, we don't use a lot of Cellzentry for other reasons. So because of that, we don't really have a lot of information about adverse effects. And a lot of long-term adverse effects we don't know because the drug just recently came out. But what is known is that it may cause liver toxicity. It may cause postural hypotension, which is a drop in blood pressure when you change position. Cough, fever, cold, rash, and potentially dizziness. So these are some of the things they list in their monograph.
Okay, so this is the conclusion. Was that too painful, except for my singing? That wasn't too bad, was it? So now, we know that y'all are the ones that we really need to pay attention to when we're dealing with education. So you are the ones on the front lines of patient care. You're the one that's most accessible to the patient. Play a critical role in keeping these patients on their antiretrovirals, especially the drugs we mentioned tonight. So make sure you get proactive. Spend time with the patient. Even if it's just a, hey, how you doing? How you doing on those drugs? Are you feeling okay? The patient may actually really appreciate that. And if they have a side effect they want to talk about, you might have to take them to somewhere where they feel comfortable talking to it, someplace more private, especially if you're in a retail situation as in a pharmacy. So we really want to thank all of y'all for paying attention tonight. So let's go through our questions that we started now. These are important. So here we go. Now, I think, should we do it as a general group or should I pick on people? Okay, we hear pick on the back and we hear general. Which one is it? Y'all want me to pick on people. Y'all just mean. You up front people. Okay. Which of the following is a potential adverse effect of quicksand? Shout it out. Number 3, kidney stones. Manish talked that one, so very good, Manish. They got it. Yay.
Number 2, which of the following statements are false? Is managing adverse effects of ARVs, does that help with adherence? Yes. Does ritonavir 600 milligrams twice a day, that's not the boosting dose that Elton just talked about. Is that generally well tolerated? No. Good. Does increased abdominal fat, is that a complication of protease inhibitors? Yes. Then managing adverse effects of antiretrovirals may improve quality of life. So the answer would be 2, right? Good.
And you'll always remember it with the boosting song. Has anyone ever heard that song? Is it really just a Dayton, Tennessee? It might be unique to me. My preacher set me up years ago. Okay. Anyway, which of the following are potential ways of managing GI adverse effects of antiretroviral agents? 1, take antiretrovirals with food, if possible. 2, use antiemetics 30 minutes prior to antiretroviral dose. 3, rule out other causes of nausea, vomiting, or diarrhea. Or number 4, all the above. It is all the above. Very good. Very good job. And that ends our presentation tonight. At this point, we open it up to everyone on the internet, out there on the internet. Yay! Y'all can applaud. Yay! I love applause. Internet people first, and then we'll open it up to the audience here.
Okay, we have more question. When a patient is on heart therapy, and there are multiple agents that can possibly cause N/V, nausea, vomiting, etc., what process do you take to rule out the offending agents, having ruled out infections?
So the question is, if a patient is on multiple drugs that cause nausea, vomiting, how do you rule out which of the drugs is causing the problem, and how do you manage that? So the first thing I do generally is look at the most recent drug. So which medications do the patient generally start most recently? So that's a good place to start. And then you can eliminate a lot of the medications from that way. And then what I do is list out of the most recent ones, which ones are more potentially could cause nausea, vomiting. So if I had a patient, for example, on Alitra and Truvada, and they just started it within a week ago or 2 weeks, then I'm pretty confident that it's the Alitra that's causing the issue and not the Truvada. However, if a patient who had, say, some chemotherapy within the last week or a few days ago, then, again, certain chemotherapies will be a higher likelihood of causing nausea, vomiting. So it just depends. So the first thing I do is look at which ones are introduced first, and then of those, look at which ones would more highly likely be causing the problem.
I do want to thank Daniel from Farah LLC. He's actually our web designer, so he does everything for us, all this technology. He flew from California tonight, so this morning. So Farah's great. If you like our website, then definitely send him an email and say, Daniel, we want you to do our website. He really is dedicated to HIV and the HIV community. His company for that. So, and thank y'all for coming. We'll see you next time.